This is an MS Views and News interview with Dawn Morgan. She's an MS patient, author, and health coach. Today, we're going to discuss developing a strong relationship with your healthcare provider. And we're going to get into that right after the jump. Like, were you someone, an MS patient, going through things with your doctor and then like, I don't want to go through this anymore, and I want to make sure other people don't go through this, so I'm going to write about it. Like, how did this come about?
Yes, yes. A huge part of your the answer to your question is yes. So many years ago, I had an encounter with a neurologist or an MS specialist and a nurse practitioner, and they were talking to me about a particular therapy or DMT that was fairly new, and I was really uncomfortable with switching, and I wanted to remain on the current DMT of choice that was working for me. However, these individuals got very upset with me, and we ended up getting into a verbal tug of war that just wasn't comfortable for me, and they weren't listening. And I felt the relationship was deteriorating at that point. And so at that time of my refusal of switching to another DMT, that's when the relationship just kind of went to shreds. And
Did you get a
so
new doctor, or like, how did this go?
I didn't. And I was just kind of grinning and bearing it.
Yep.
And then I said, you know what? Over the years, it just stuck in the back of my mind. Eventually, I did change,
Yeah.
but I've had a handful of MSers discuss with me their relationship with their providers, their healthcare providers. And I said, this triggers me. I have to write about it. And I want to make a change. And I want to help people develop and cultivate a positive and strong relationship with
Well, we
their
thank you
healthcare.
for it, because the road that you are making by walking, if we are stumbling in our own way, we have example, we have records to pull from your experience to be able to hopefully mirror in our own experience, you know?
Yes,
What are
absolutely.
some, it's not what are some things, like how have you like, it's the relationship between you and the healthcare providers, kind of what I'm getting at. So how have you begin to build or rebuild that relationship with your healthcare provider?
I think the first step in building or even rebuilding is communication. It's a relationship. And in any relationship, whether it's romantic, familial, parent, child, if you don't communicate appropriately, or human with a pet, how are they going to understand, right? How will they
Absolutely.
understand?
Absolutely.
And what you need. And ultimately, we all want to get our needs met. And as patients dealing with a chronic illness, we have a lot of needs. And if we are not communicating effectively, how will the healthcare professional know what it is that they're treating, or know how to discuss different symptoms with you, or whether or not you need a psychiatrist versus a psychologist? If you don't communicate, you don't know.
The other side to that too is, the if you are vocal in communicating, there's an element of medical gaslighting that gets to just hop right in, where the provider just might not believe you. The provider might just say, oh no, that's in your head, or fill in the blank, and either not treat it or just dismiss it as some small thing. But
Absolutely.
you're like, bro, I'm sitting here, I know my leg is hurting, I know my gait is off, I know my vision's off. Like, is it what your experience, and sometimes the doctor's understanding of your experience, and their willingness to get at this with you is different. It's a little different, and so that's really speaks to the heart of what you talk about.
For sure. I think, again, speaking with patients, chronically ill patients, specifically multiple sclerosis patients, quite often they'll go into the emergency room, or they'll go into their regular appointment. Let's just say emergency room. And you don't know, if you don't know about MS and you don't know what is happening to you, there are times when physicians will say, oh, no, it's fine. We'll just give you a Tylenol, or we'll just give you some, ibuprofen, or give you some IV fluids, and you'll be fine. And that's when you step in and say, no, I'm going to be my own self advocate. And you throw the question out there, which is a term that I recently learned about, and it speaks on what you just brought up. You talk to them and you say, okay, well, I'm listening to you, doctor, but I am having this pain in my right foot. Please explain, what is the differential diagnosis? How do you compare this problem that I'm experiencing with the pain that you are stating that I'm feeling? And so let me just, yes, I'll just okay. I will share, because I don't remember it off the top of my head. I'll share what differential diagnosis is when you are being your own self-advocate.
That's 8 syllables, Dawn. Differential diagnosis. That's 9 syllables. Okay. But you feel that, and you know that it's important for us MS patients. So please hit me with that.
Absolutely. It's very important. And so it is the process of differentiating between two or more conditions which share similar signs or symptoms. So if a healthcare provider is saying, oh, you can just take an ibuprofen for that pain, it's probably just a twisted ankle. Well, no, it's numb and it's tingling. It doesn't feel like a twisted ankle. So can you give me the differential diagnosis here? How do you compare those two? Does this make sense? I hope I'm making sense.
I was just about to say, so like, if I'm like, there's pain in my leg and my foot and in my foot and my ankle and my leg, so that's a thing, and the doctor's like, no, you just roll your ankle, go on with it, and the differential diagnosis pops up in this way. How?
It's having that healthcare provider, having them explain it in their terms, and comparing it to what you are facing.
Wow.
And trying to make sense of it, because what you are explaining doesn't equal and add up to what they're saying. Oh, no, it's just a sprained ankle. Well, sprained ankles don't accompany, numbness and tingling don't necessarily accompany a sprained ankle.
Yeah,
That makes sense.
absolutely. No, there's cognitive dissonance is not the right term, but there's hey doc, I'm experiencing this, and the doc's like, well, it can't be what you think it is, because X, Y, and Z, and here's something that's unrelated to your issue, and goodbye. And you're like, no, but wait, this is actually related to my issue. Can we please stay on this? And you're already back out in the waiting room.
Correct.
You
Yes.
don't need that.
Right. Because the symptoms are similar. Yes, you have pain, or you have, I won't even say pain. You have discomfort. There's discomfort there. Numbness, tingling is not comfortable. Having a sprained ankle is not comfortable. But can you explain why I'm numb and tingling? It's not just a sprained ankle. So I need to be validated. I need you to look further into what I am explaining to you. And that is kind of a part of self-advocacy. It is asking for more information so that you can better explain.
There seems to be, like, you have to walk the line between the hypochondriac MS patient, where like, oh, this is hurting, and doc, you're not explaining it to me, so it must be all in my head. Hey, I'm experiencing this thing, and doc's like, well, it can't be because of this, or it's, here's why. But it's like, well, what you just said doesn't really speak to my specific thing. It might speak to the specific ailment, or whatever it is overall, but me specifically right here, right now, nah, it's not in that conversation. So we're gonna have to do a take two of that, doctor. And that's where being a proper one's own patient advocate, to put a term on it, one's sense of self has to come in that appointment, to be able to stand 10 toes down and be confident that, hey, medical professional, this is what I'm experiencing. Yes, it can be explained away in another way, but I know that is different than my experience. This is my experience. Help me go through that. Help me get through this and to the other side so that I can have another experience.
Spot on. Because this is, speaking of the word experience, this is our lived experience. And when we communicate, going back to our first point, when we communicate, we're able to share and to create some level of compassion, which doctors should have, and empathy, because our
Compassion? Empathy? Oh goodness. Now I make light of it because a lot of people have medical providers that have that in them. Of course they do. Some folks are not fortunate enough to have medical providers with compassion and empathy, and especially compassion and empathy enough for them at that moment.
and when you are communicating and when you recognize that, yes, my healthcare provider has compassion and is showing empathy, it builds trust. What is a relationship without trust? And if I can't trust you, you know me from the inside out. You know my brain, you know all of the where the myelin is deteriorating, you know where the myelin is everything is all broken. You
Mhm.
know me.
Mm,
And so it is a vulnerable situation when you are in your patient's or in your doctor's presence.
absolutely.
And uh, if I can't trust you, we will not have a healthy patient outcome. And that is the goal, correct? Isn't
Yeah.
that the goal? For us to have a
Yeah.
healthy patient outcome.
So, as a health coach, how do you even coach people through these sorts of squirmy feelings to be able to stand up for themselves is like the wrong thing. My New York hood self says, stand 10 toes down, like you're not moving. Okay. So how to help somebody else stand 10 toes down when they are explaining their experience and the medical professional is taking their experience and attaching it to some other reason and dismissing their own dismissing that patient's experience as part of their MS.
Great question. And the upstate New Yorker in me would say, Doctor, I don't feel as if I'm being heard. And
Mm,
I need you to hear me, or I would like for you to hear me. I think approaching it from a more gentler and softer way, you get more, as my grandma used to say, you get more bees with honey. And if if you approach it in that softer tone,
yeah.
saying, I need you to hear me, because that word "hear" is huge. It's huge. Don't listen just to speak, doc. Don't listen just to speak and talk your doctor vocabulary at me. Listen to really digest what I'm saying, because I need you and I want to trust you.
I got a stronger relationship with you right here, right now, just even hearing those words. And you're not even my healthcare provider. Well, anything else that's in that hodgepodge of figuring out a better relationship with your healthcare provider, developing that trust. Anything else?
I think also having the doctor there to guide you through disclosure and confidentiality, because a lot of patients don't necessarily want to talk about MS with family, with friends, at work. So I you would need advice from your healthcare provider. How do I approach disclosure when I don't want to talk about it, or when I do want to talk about it? Where do I go? Because that's a huge question for a lot of newly diagnosed individuals, and even individuals who've had MS for 23 years, like myself. I still have moments where I don't know, should I tell them? I don't know. But, you know,
Yeah.
that's a long, long conversation. But I think that asking for help in that, you know, um, in that way to your doctor opens up another conversation, and also is developing and building the blocks to trust, because this is supposed to be a long-term relationship. And hopefully it's a long-term relationship, and you want it to be
Hopefully.
as healthy as
it's profound and it's powerful. The things that you're stepping in, that you're walking in, and that you're modeling for other people to experience for themselves, for them to personify. I'm getting out of here. What was the last thing you would put on people's hearts and minds around this matter?
Um, Take notes.
Mm.
Write down how you're feeling. Um, Write down a list of, these are my wins. These are my wins for the day. Or how, MS takes a lot from you. So talk about what has worked for you. Carry that to your next appointment and say, Doc, this is what's happened to me. These are the good moments that I've had with MS, and these are the not so good moments. And again, creating this continuous flow of conversation. I can email my MS specialist anytime, day or night, and she will write me back. And I love that. And that's because I've utilized my voice,
Mm.
and I jot down notes and I tell her, these are the things that I'm working on. These are the things that have bothered me physically, emotionally, all of that. So the best thing I can say is just take notes. And again, I can't stress it enough. Communicate, use your voice, use your voice.
It sounds like it's something that develops, and a lot of times, myself included, you just are just not in good shape. You just show up at the doctor's doorstep and you're like, fix it, make it better. And that's not really their role in that regard. And there's some give and there's some take and there's some work that you have to do on your part. You have to make note of it. You have to be your own medical stenographer. And that's not fun. And that's not easy to remember, especially when you're in the middle of the health thing. But it's something that can certainly serve you, and it serves the relationship with your healthcare provider. It definitely powerful and profound things that you touched on here today, Don. Thank you. Where can people find you on the interwebs?
Can I just add one thing before I ask before where they can find me? I
Please.
say take note because sometimes you may forget. And if you're not able, sometimes the MS affect those people's voice and how they speak. I think dysphagia is what it's called. And so if you're able to write it down, it it's easier to remember and it's easier to communicate in written form sometimes. So
Absolutely.
that's why sometimes it's hard for people to speak. So writing could be easier, or transcribing.
Write it down. And Dawn, she just underlined it with bringing it back to that statement. Like, no, I'm gonna let you know where I'm gonna go be at, but also write it down, son. I would make sure that gets hit home and that gets left with the people, because it's very simple to say, oh, maybe I'll remember it or maybe I won't. Like, no, again, this is your well-being, and we cannot outsource it to other folks. The professionals are the professionals in a certain way in the medical dialogue, in the medical components, but they're not a professional in you. You are professional in you, and it's important to make sure that your MS self can actually feel heard and listened to by you. That's the dance that we all go through. And when your MS self feels heard, hopefully it'll be a little less quiet.
So to answer your question, people can find me. I'm on Instagram, Dawn_Janine. I'm still there with the Unquiet Mind podcast. I'm on YouTube and Instagram and LinkedIn, Dawn Morgan,
Mm.
Facebook, Dawn Morgan.
We got some podcasts, we got some Instagrams. And again, as a health advocate and figuring out those marks in the road and what's important and what's not, and how do I translate my feelings into something concrete that can help not only myself but other MS patients around me. That takes a special kind of willpower and gas and focus. And I am one to sit here in this space and say, thank you, Don. Thank you for walking through your own resistance. Thank you for figuring out and seeing that this is important. And thank you for saying that you will be the one to put words behind it and make it seen and make it important, just as important to other people as it is important to you.
And my ebook is on Amazon. The relationship between patient and healthcare provider, things you both need to know.
The relationship between healthcare provider, say it again.
The relationship between patient and healthcare provider, things you both need to know.
Woo! Get it on Amazon, y'all. Nothing to really done. Thank you for showing up in this space. It's wonderful. And thank you all for watching. And we'll see you on another MS Views Now. Thanks, everybody.